So.
You may need to pull the mic down. That's what you should be. I'm busy. Hello, good afternoon. It's nice.
Good
I guess it's
afternoon.
time. We should start by now. So thank you so much for coming to this data access governance and ethics session today. Our first presenter, the study is about research governance strategies to safeguard the personal information of children and adolescents in sub-Saharan Africa. So this was done by Dr. Lucas Hertzog with Dr. Boladé Banougnin and Dr. Elona Toska, to be presented by Dr. Hertzog.
I think I'll speak here. Yeah, perfect. So, hello everyone. Good afternoon. My name is Lucas Hertzog. Thank you for presenting my Manuela. And today I will speak about some of the work we've been doing at the University of Cape Town in collaboration also with the University of Oxford. And our work is funded by the Global Challenges Research Fund within the scope of the UKRI and also the Oak Foundation. So the context of our research projects, we are working with children and adolescents in sub-Saharan Africa. Our research consortium, it's a multi-country transdisciplinary research consortium led by University of Oxford and also University of Cape Town. And one of the main focus of our project is trying to understand and identify some solutions on evidence-based interventions for adolescents in the continent. And this is aligned with the perspective of the UN SDGs, the Sustainable Development Goals. And we try to identify solutions such as programming for health, food security, social protection within the continent that has multiple impacts in the lives of adolescents. So as I mentioned before, the main goal of our team is to produce high quality evidence that could improve the life of adolescents and also to meaningfully involve them in the research process. And when I say that, to meaningfully involve in the research process, we have one group called the Teen Advisory Group, which is a group of adolescents in the Eastern Cape Province in South Africa. And whenever we have questionnaires, we formulate questionnaires for our surveys, we go to them and they advise us, advise the researchers how we properly should pose a question, if the languaging is correct, and also to have a sense check with adolescents. And we have mostly cohort studies, also use cross-sectional data for our analysis using large survey data. but we also have some randomized control trials and qualitative studies going on. But today, I will present to you, I'll speak more about our research governance strategies, focusing on quantitative research. And this, we have two kinds of data that we use in our research projects. First, I would say primary data. And then we have like our in-house studies that you can see here highlighted in yellow. And we have partner studies in Ghana, Nigeria, Tanzania, Malawi, and Zambia. And we have our in-house cohort with adolescents in the Eastern Cape province in South Africa. But we also use some secondary data for conducting our analysis, such as the ongoing collaboration with the Center for Disease Control in Atlanta. They have the Violence Against Children Service, which is a large survey conducted in 15 countries in sub-Saharan Africa, and also in Latin America, and the Caribbean, and Southeast Asia. And we also have ongoing collaboration with the FIA, which is a population assessment study run by ICAP at Columbia University in the US. Also an ongoing collaboration with MIX, which is the multiple indicator cluster surveys run by UNICEF in multiple countries. And also the Young Lives Data, a cohort in Ethiopia, run by University of Oxford. Just to give a brief summary of that, this means that we are conducting research in 14 countries in sub-Saharan Africa, and this could potentially impact 395 million children and adolescents aged 0 to 24 years old. So we try to summarize here some of the structures that we created in our research governance team, so we could protect the data of children and adolescents and their personal information in the process of collecting data and also curating the data throughout the data life cycle. First of all, we need to have some perspective on how to have enhanced ethical approval from the committees, because it's increasingly the ethical committees, they request things about data management and also for compliance mechanisms with regulatory frameworks. Also the informed consent form, which needs to be reformulated from the previous studies that we were doing, because now it has to incorporate some regulations such as GDPR and POPI Act in South Africa. Also, one of the mechanisms that we use is to have capacity building in our team, creating a structure in the research governance team that deals with data management and ethics. And this is an ongoing process of training personnel and staff. The data management plan, of course, which everyone is aware the need for having data management plans across the studies, particularly for the studies with primary data, they're crucial, but we learned during the process that also secondary data, we also need data management plans for them. The PIA and the PIA, which is the impact assessment, impact risk assessments, which has like different wording here. We have the POPI Act wording and also the GDPR wording, but in summary, is the risk assessment to see for data, the data we are collecting, it's a high risk, medium risk, or lower risk. The data sharing agreements, which is also one of the strategies that we use for protecting the data and also comply with the regulatory frameworks and mechanisms. And of course, the last component would be awareness of how to protect the data throughout the data life cycle. So just to speak a bit about these structures that we created. And first of all, our research team, as we saw in other presentations, what triggered this was mostly the new regulatory frameworks such as GDPR. And we realized that we were dealing with too many data, and we needed to structure a research and governance team within our current staff and also hire new personnel for that. So we draw a very basic organogram having the people involved in the research process that will be handling data management processes and also other research governance mechanisms. And we have at the University of Cape Town some people working with that. Some people are working full-time with that, such as our junior information officer at the University of Cape Town, and others, like myself, work a percentage of our time allocation for this kind of job. And one important thing for us was also to identify the key staff that will be working with us at the University of Cape Town and also at the University of Oxford for security and infrastructure, also people related to working with contracts, ethics, and also data protection. So I think this was our first step in structuring our team to see what would be the compliance mechanisms that we would use to protect the data that we were handling. And of course, along this process, we started to create this document, which is research governance guidelines. So we could create this structure, and if we have staff turnover, people can take a look and also learn with this document, which is a live document. So one of the key mechanisms for us to protect data was to have continuous capacity building sessions for our staff, for training, but also for sharing knowledge, because we realized that we already had in our team structure people with lots of experience in data management mechanisms, in ethics applications, and also some people that knew about data regulations such as GDPR, POPI Act in South Africa, and also new regulatory frameworks in sub-Saharan Africa. So our trainings were basically there were some more technical trainings on how to use the server, how to store data, how to archive, how to properly curate the data throughout the data lifecycle. Some of our training sessions were about, like this one in the middle here, in the Protection of Personal Information Act from 2013, which is the POPI Act in South Africa. Some other trainings about de-identifying data, pseudo-anonymization of data, and how was the step-by-step approach on doing that. And we also involved our teams, our researchers, and field workers. Here we have one example of our studies, which is the Hey Baby, which is a study of adolescent mothers living with HIV in the Eastern Cape province. And we brought them inside this process because we thought that we could learn a lot about protecting the data, listening from the people that were the most concerned about this topic. So one of the things we realized that increasingly the research ethics committees, they started to request very detailed information about the handling of digitalized personal information. Some of our researchers started their cohorts in the 80s and in the 90s, where you had like mostly paper-based questionnaires. And they brought us to the attention that this kind of new information that research ethics were asking was something new. And then we realized that we needed to create a structure that it could cope with that. So in our ethic applications for new studies, we started to include a basic data flow, also information about consent and data management responsibility. Our informed consent forms now have a specific part of it, a paragraph saying how the data will be handled throughout the data life cycle, so people can be aware of what's going on in the future with their data. Also, issues about confidentiality, they are quite new in terms of these regulations, and also limit access to operators, retention of data, security across the data life cycle, and very importantly here, particularly for longitudinal studies and randomized controlled trials, the personal information withdrawal. Like, how can I be withdrawn from the study? I don't want to be part of this anymore, and this needs to be clear in our informed consent forms. So also one very important process for us was trying to understand informed consent as a negotiation process that happens during field work. And this, we needed to work with our staff for them to be trained and explaining to people what were the risks, of course, in participating in the research, and particularly with children and minors. It was important for us to create this dialogue with their caregivers. The caregivers needed to understand what the research implicates, the risks for them and also for their children. And also we saw that this was a great opportunity also for us to create awareness about personal information and privacy rights. Some of the people that were interviewing the field, they had no idea they had privacy rights. And this was a process also of capacity building the people, the participants of our research projects. And one of the things we always discuss, it's about the power relations in place when we are conducting research, because we are researchers from universities having funding from abroad, and we go to several places with vulnerable populations, and we need to understand that there are power dynamics here, and we need to be aware of that. And one of the things that I already mentioned, which is quite important, is withdrawal. This is something that we try to emphasize the most, like saying to people that if they want their information to be withdrawn, they can do it at any time of the study. And this is because most of the data we do is highly sensitive, such as data about sexual abuse, HIV biomarkers, violence, criminal behavior, which is something that it's important that the person can remove themselves from the study at any time. Other mechanisms that we used in our research projects, it's the DMP. I don't want to be extensive on that because probably I have people with much more knowledge than myself about creating a DMP and also curating the data. But the key 4 elements that we try to have in our research projects, which is having a description of our studies, what is the study is about, how we are going to store the data, what are the security mechanisms that we use, and how we are going to sharing and reuse the data. The personal information impact assessment, also it's an instrument that we started to use more frequently, and it has 5 key elements. First is to risk of individual identification, which is connected to the loss of privacy. Second, the second element was trying to understand if the data we are collecting could lead to stigmatization, discrimination, bias, trauma, or legal persecution. And also the place of processing, which was quite important for us, because now we have people working from abroad, and sometimes we hire people from foreign countries to analyze data from South Africa. And this was something that we needed to understand what were the risks involved in that. Also, one of the elements here was the unique identifiers and confidentiality, because some of our data we cannot de-identify because of legal reasons. Sometimes we have to go to the police because some children, they might have victims of sexual abuse, so we cannot de-identify. We need to bring to the police whenever we collect this type of data. And also we have, when it's possible, the mechanisms for de-identification and pseudo-anonymization of data. And here is one part of our mechanisms that we try to create several data sharing agreements with all the involved parties. And the idea here was for us to have the terms of co-ownership of data and joint responsibility. So this is, of course, based in mutual respect and cooperation, trust, and communication. And we also try to address in these data sharing agreements the global South-North relations involved, because we know that sometimes the money comes from abroad, but the institution that receives the money also has some voice during this process. It's time? Oh, sorry. So I'll just finalize here I wanted to speak a bit about the data life cycle and also the workflow. But for us, just to finalize with the challenges and next steps that our structure and our team is working on, is that we incorporate the changes in these live documents, such as data sharing agreements and data management, also update our structures, funding for research and governance, and also structuring careers in research and governance, which is quite important. So, thank you.
Thank you very much, Dr. Hertzog. He's actually originally from Brazil, but is now based in Cape Town, Africa. So for questions, yes, there's no question on Zoom, right? None so far.
Hi, and thank you for your presentation. You've mentioned, for example, GDPR, you've mentioned the Protection of Personal Information Act in South Africa. I have a question. Do you have, and how do you deal with challenges when there are discrepancies between different protection acts from different countries, because your research is done in, I don't know, different African countries? I guess data is published and stored somewhere else, or in some cases, different locations. Do you have any thumb rule which act applies, or do you simply just go for the, I don't know, uttermost protection of personal information to be on the safe side?
Yeah, that's a very good question. Actually, this is even the answer. We stay with the higher protection that we have. But one of the things we learned with the POPI Act is that they created a mechanism that sometimes even more protective than GDPR. So whenever we are but submitting some application through the ethics committee in Oxford, sometimes we are using the standards by the POPI Act and not GDPR. So it's a continuous feedback process. And also one of the things we started to be aware is that new regulatory frameworks are being consolidated. I was just speaking with a colleague that from the parliament in Kenya. He said that like a month ago, they signed their Personal Information Act in Kenya, and they are popping up like in all countries, as we expected, of course. And this is one of the challenges for our team to be like analyzing all of them and trying to compare and see what is the best match for our studies.
Hi, thanks so much for that. I was really, really interested to hear what you were saying about involving children and young people meaningfully in research. I'm from the Administrative Data Research Center in Northern Ireland, and we are actually just begun piloting some work with young people in care around research using large-scale administrative data sets. And I was just wondering if you could say a little bit more about how you guys go about doing that, and particularly when you're talking about raising awareness of privacy rights and children's rights within the kind of regulatory frameworks and the works that you're doing. How do you pitch that? Like, how have you gone about deciding, you know, what level of information needs to go into that, and actually talking, are you talking to the children and young people about that? Is it just their caregivers, or how do you decide where to pitch that information?
Thank you. It's a very good question. Yeah, actually, this is a process because as we conduct large surveys, whenever we go to field work, it's like 8 months and 250 people involved. So the first thing that we need to do is to train the staff for them to understand what are the implications of these new regulations, and also how can they put it in a very simple language that is understandable. And also we write down everything. We have something like a guide for them to go into the field and speak to people. And of course, we try to do it in a child-friendly language when it's with children, but also needs to have the consent of their caregivers. And I think we started to realize that this was also a capacity building opportunity for our participants when we went to the field and people started to say, oh, I didn't know I had these rights. I didn't know about what was the data life cycle after I responded this research. And this, we realized that sometimes we had some colonizing structures within large research projects. Like you go and do your helicopter science, collect data, and you never get back. So this was the motivation for us to structure a teen advisory group that we have like monthly meetings with them. And they also go to the University of Cape Town to teach us, which is something that we quite appreciate for us to learn with them and how to improve our research projects.
All right, thank you. Thank you very much.
Thank you.
Our next presenter, I can see her on Zoom.
You have to sign in.
All right, while we're preparing for the presentation, our next presenter is Titilayo Comfort Ilesanmi from the University of Ibadan. And her presentation is entitled Data Access Before and Now, a Nigerian University Library Experience. So she'll be presenting virtually.
Signing, I haven't got it.
Good afternoon, all. I hope you can hear me. Good afternoon. Good afternoon, everyone.
Yes, we can hear you.
Okay. Could the planners enable my screen to be shared, please?
All right, while they're tinkering on the unit, we still have like 2 other presenters, one virtual and the other one is, I believe, also virtually.
I'm trying to share my screen, but it's not responding. It said others are sharing, so I can't share at the same time. So I don't know.
We can hear you, but I don't know. It looks like the screen sharing is withheld.
It's telling me you cannot start screen share while the other participants is sharing. So what do? I've shared I've sent a copy of the PowerPoint slides to Manuela. Maybe it could be shared from your end over there? Is it possible? Or should I go ahead discussing the issue? Yeah. I'm finding it difficult to share. Yes,
from the University of Ibadan.
Yes, the
Please share
PowerPoint
your
is not
screen.
allowing me to share. Okay. I don't know if it should come up now.
Which one?
Can you see the PowerPoint now?
Yeah.
Hello, everyone.
So
Is the PowerPoint coming up?
Yes, we can see your screen clearly.
Oh, beautiful. Yeah, like you have rightly said, my name is Titilayo Ilesanmi from University of Ibadan. I'm here to share the experience of data access before and now at the university. You all agree with me that libraries could be physical, virtual, or mobile, and they are responsible to acquire information resources to accommodate users and to ensure that information needs of the users are met from time to time, regardless of location or time. Part of the responsibility is to grant access to information resources of different types and formats as it may require of any of the users or researcher. Therefore, the roles of the librarians cannot be overemphasized because they are responsible to ensure that these information resources are promoted on different platforms to enable users to make optimal use of it, in which data access is inclusive. Information is vital for decision making as well as other needs of human endeavor. So it is essential that users, especially researchers, are aware of their availability, access, and they can make use of these information resources at any time they desire to do so. However, many of these information resources are still in print formats, whereas their content is still useful for study, research, and development. Therefore, there is need for the deployment of information and communication technology to enhance the better visibility, access, use, and posterity of these information resources that we have in our holdings. Background information of Kennedy Library. Kennedy Library was established 73 years ago alongside University of Ibadan to support the research for development of the institution. So the library builds collection in volumes to ensure that this greater height is met and sustained. Many of these resources are in print format as well as in electronic formats. Furthermore, we have different sections in this library, such as collection development, cataloging and classification, reference, and other sections and units in the library, the information and communication technology unit that works together as a team to ensure that information needs of the students and staff are met to time. Reference section of the library is responsible for meeting the information needs of users, that is having a face-to-face or online communication with our users on reference resources in which thesis and dissertation are embedded. And this takes me to the subject of discussion for today, data access at global level. Data can be referred to as the facts. Sorry, please. Data access can be referred to as the facts and figures emanating from research. And Longman Dictionary of Contemporary refer to data as information or facts. And in the context of this paper, I refer to data as long essay, thesis, and dissertation emanating from University of Banougnin because, data such as instruments of a particular research, the findings, the recommendation, discussion, conclusion, which could be used and reused, are embedded in these information resources. Globally, data could be accessed through online databases, online catalogs, professional group platforms, search engines, to institutional repository, to mention but a few. And Muibegu 2019, Smith and Lee 2017 also established that data access will foster research for development. Mode of data access at Kennedy K Library before. At the early year of Kennedy K Library, data was accessed through conventional method. And by this, when the thesis and dissertation are received from the postgraduate college, the collection development section of the library received them, and it's been processed and moved to reference section, whereby users can request and make access, make them accessible to them. And for this reason, whosoever may want to access our original and unpublished works needs to visit the reference section of the library to do so. So part of the responsibility of the staff in this section is to prepare and compile the bibliographic details of this thesis for its easy accessibility. For instance, the thesis information, bibliographic details are compiled by faculty, by department, and by the author surname and title, and so on, to ensure quick access to these information resources. And also in the time past, this thesis and dissertation were cataloged and classified, whereby author catalog card could be, accessed to check what is being needed, and the information copied out and is being brought to the reference section for retrieval by the reference staff to the users of such information. We do receive researchers from other parts of the world who comes around with referral letter to access this data. And to date, we still have few who comes around to make use of the thesis and dissertation in the university library. When they search the compiled list, there is a form being given to them to fill, so that we know what their choice or choices are, and we'll be able to retrieve for them. And this is a form being filled by user who may want to use this information resources. And that is how the thesis and dissertation are being accessed in the conventional way. But now, recently, around 2014, the mode of data access changed, and though not totally virtual, but combination of virtual and conventional. Whosoever wants to come to the forewall of the library can still access the thesis and dissertation, and who may be far from Nigeria could also access the thesis and dissertation of the university virtually. And through the university website, we have a slot for the library, and under library, we have UI repository, which is being embedded by this space. And here it could be searched from all over the globe, and thesis and dissertation and other publications emanating from the university could be accessed through this platform. And by so, no restriction is placed on the virtual access. Anyone can access data on this platform anytime, anywhere. And it could be accessed using desktop, computers, laptops, mobile devices can be used to access this information. In Nigeria, in the year early 2020, we experienced the COVID-19 lockdown to like all over the world, and the library was locked down, and that doesn't stop the access to this information. That is, this is a dissertation during this period, because our researchers, our students, and other researchers around the world can go to this websites to have access to the thesis and dissertation already uploaded into the database, though it is still an ongoing event project. And we found that we have benefits of making this information accessible virtually. Users can access data from any part of the world, like I've rightly said. Data can be accessed simultaneously. That is, more than 2, 3, 4 people can use the IR to search and retrieve whatever they need. Whereas in the conventional method, it's only one at a time that a particular person can use a particular material or a particular thesis or a particular unpublished work emanating from the university. Also on this platform, with the Dublin Core metadata enabled in this space, users can search maybe with the author surname and the year or the keyword, and by so doing, they can have more results that could enhance their research. Then it enhances the visibility of the research outputs of our university, and the citation of such work is also an added advantage to the university and even the scholar or the author of the work. Also, plagiarism check is applied before addition of recent thesis and dissertation into the repository to ensure that it is not a duplicated work from elsewhere or original work of somebody else. So one is sure that the ingest of thesis and dissertation into the repository is safe and is available and accessible to our researchers. Also, the institutional repository first making the work available on it fosters interdisciplinary, national and international partnership and collaboration among researchers, because when it is visible, we find researchers from other parts of the world that could be interested in whatsoever that particular author has worked on or intend to work on, and they can collaborate to work more on the same subject or specific area of study. In conclusion, data access has been embraced in developed and developing country tertiary institutions, especially the university, in which University of Ibadan is inclusive. And data access before was achieved through the conventional system, that is manually, while data access now is achieved by hybrid system, whereas one can make choice, and especially those who are not within the country, wherever they may be around resources at any point, at any time and anywhere. Thank you for your attention.
Thank you very much, Dr. Ilesanmi. All right, for questions from the house? There's none. How about on Zoom? There's none. So that Dr. Ilesanmi, thank you so much. Now let's
Thank you.
proceed. Let's proceed to the next presenter. She will be presenting online as well. He rather. So Dr. Chifundo Kanjala is a PhD holder in epidemiology from the University of London, and he's got his Master's of Philosophy in Demography from the University of Cape Town and a Bachelor of Science in Honors Statistics from the University of Zimbabwe. So he has worked in research, data analysis, and metadata management roles at UNICEF and across multiple health and demographic surveillance system projects, including the Alpha Network and the Inspire Network. So for the past 10 years, Dr. Chifundo has worked for the London School of the Hygiene and Tropical Medicine based in Tanzania, and later at the Malawi Epidemiology Intervention and Research Unit. His work within LSHTM has been at the intersection of population health, research, and IT. So in this regard, he has used domain knowledge, quantitative and computing skills, metadata standards, and research as tools in developing, analyzing, and sharing data resources that are compliant with the widely recommended fair or findable, accessible, interoperable, and reusable data stewardship principles. He'll be presenting the Malawi Health Research Data Sharing Framework virtually. Dr. Chifundo, please take it away.
Thank you very much, Manuela. I hope you can see my screen in presentation mode.
Yes, clearly.
Okay, thank you. I'll try to make my bio shorter next time. Sorry, it sounded a bit long. So I'm going to present today some of the work that we have done in Malawi in developing a data sharing framework. This is work in progress. We started working on this as part of the interactions between the health research community in Malawi and the ethics bodies and Ministry of Health. So as a we started this as part of a conversation between the researchers and the regulatory bodies to sort of build a framework that can guide data sharing, health research data sharing in Malawi. So I did this work together with others who were part of the task team that has been working on this. So the ultimate goal is to have a health research data sharing framework to guide health research data sharing by research institutions in Malawi. What I aim to do in this presentation is to report on our progress so far, and also to say what our plans or aspirations going into the future are. Hopefully to get inputs from others who may have experience in this kind of work. So I'll give a background. Just to say briefly that we see in literature, I think it's widely known now that there are advantages for data sharing, but also there are some requirements for data sharing, particularly with funders of research and journals, requiring that when there are publications made from data collected using funding from research funders, the data should be published as well, so they can be reused. But there are also concerns about data sharing, around misuse of data that may end up hampering science and health, and also ethical concerns to do with the privacy of the individuals involved in the data. And there are barriers to data sharing, such as costs and setting up and maintaining infrastructure, and also lack of guidelines, which I guess is one of the challenges we're trying to address with this data sharing framework. As you will see later in the presentation, Malawi is in Southern Africa. So the global South has general concerns. We see this in the literature. There are concerns about equity surrounding data sharing. It's quite difficult. I mean, people who do research in the global South will tell you this. It's quite difficult to collect data and to process and manage those data due to some, limitations in infrastructure. So there are concerns that, if there isn't careful considerations, data sharing may end up disadvantaging those who are collecting data, because others in the global North may, have equipment to do the analysis. Those in the global South collect the data, but then would need a lot more time and infrastructure to analyze the data. So some controls or measures need to be put in place to ensure the equity. And also the need for capacity building so that those who collect the data are also able to analyze and get insights out of those data. I'll move on now and give a little bit more context, the Malawian context. So perhaps many know where Malawi is, just to be sure. It's in Southern Africa. You see that red, the country shaded in red on the left there. And then in the middle of the map of Malawi, it's located in Southern Africa. According to the census that was last done in 2018, 2019, there are about 18 million people in Malawi. It's a very youthful population and generally peaceful since attainment of independence in 1964. And it's among one of the least developed countries, with a GDP per capita as of 2020 around 636.8. In terms of data, I hope these two pictures here can give an idea what the data issues could be. So on the left, I'm showing the coverage of live births registration, and on the right, coverage of death registration. Though there are improvements, there's the birth and death registration are still not as sufficiently covering as of now. So there's a general data scarcity on one hand, and then whatever sources of data that are available, you find that they're usually not sufficiently shared. So that leads to issues to do with duplication of efforts, and also I think inefficient use of resources, because if someone gets funding, they collect data, they don't share those data, someone else collects the same data when they could have used whatever was collected before. So that's the context within which we are developing this data sharing framework. So what are the key legal provisions for health data sharing in Malawi? The Constitution, in general, high-level terms, covers this. And there was also a health information systems policy, which was developed in 2015, E-Transactions and Cybersecurity Act, which seeks to sort of monitor and promote security of data, mainly online. And the Access to Information Act of 2017, and perhaps the most relevant is the Malawi Data Protection Bill that was put forward in 2021. So it's not an act yet, but when it has been enacted, perhaps it will provide more guidance. So at a high level, those are sort of the general laws that control or that govern data sharing in Malawi. So within the Ministry of Health, there have been some efforts to try and help players within Ministry of Health and collecting data from individuals for health research. Even there have been some efforts to operationalize health data sharing through the development of a standard operating procedure document on data access and release. So it provides the steps or the procedures to be followed for requesting for access and for accessing or for releasing data, mainly from the Ministry of Health, but can also apply to a research institution that wants to share data. And together, this SOP is accompanied with data sharing agreements. We think that between the laws, the general laws that govern data sharing and this standard operating procedure, we think somewhere in between, we need a framework that can guide researchers who are collecting data in Malawi. So researchers working in Malawi, they're participants in a larger global community of health research. So they need to leverage benefits of data sharing, just like anyone else who is working elsewhere, and to fulfill requirements from funders and journals if they are going to continue with their work successfully. But they also need to contextualize data sharing because they are doing this research within a country that has its laws and requirements. So sharing has to acknowledge the laws within the land where the research is being done. And this Malawi Health Research Data Sharing Framework that we're trying to build, we think can guide sharing of data generated in Malawi. So far, I've just given a quick background of what we see in the literature and also a bit of context of the Malawian context. So I'm going to talk about this data sharing framework now, our progress so far. It's in no way a completed project, but it's work in progress. So hopefully from sharing this, we can get others who are familiar with this area, get their inputs in the process. So what we currently have is what we are calling a draft 0 that we prepared by reviewing the literature and carrying out meetings with international experts managing data sharing platforms. In particular, we have been in touch closely with the colleagues from the Closer project at UCL. So John Johnson and Hayley Mills, if people are familiar with them. We're also in touch with data experts working in Malawi, Ministry of Health and Information and Ministry of Information representatives. So what we currently have, the current version of the document that we currently have is just a largely summary of notes from the meetings and from the literature. So as you can imagine, there are gaps in there and questions that we are hoping to answer going forward, and would appreciate input from others who have worked in this area. Okay, so so far the take-home message that we have in this data sharing framework is that to sustainably share data, there are a number of key considerations that are foundational. It should be, we think, a data strategy, compliance with legal and ethical environment, a sustainability plan, compliance with technical and other standards, and adequate infrastructure. So this is sort of a high-level view of this framework. So a strategy at the bottom, ethical considerations, legal considerations, and then the issues to do with sustainability, standards, and infrastructure. We think with that framework, we can sort of operationalize health research data sharing. These are just more details on the left going down, showing the various components of the framework, and going across at the top, the various key roles or players that we think would be involved. So I will also talk about the other developments closely related to this data sharing framework. And one of them is the development of data centers at 2 national universities. We think that though all these efforts seem to be, their infancy, but I think it is a good opportunity to think about this data sharing framework in relationship to these two data centers that are being set up. So in the northern part, there's the university, the Mzuzu University. They are establishing a data center as part of refurbishing their library, which was unfortunately destroyed by fire a couple of years ago. So rather than just rebuilding it in its original state, they're also establishing a data center through some work and collaborations with Virginia Tech. And also in the capital city and further south in Blantyre, the Kamuzu University of Health Sciences, they also have a data repository, a data center that they are establishing. So we are working closely with our colleagues from these two institutions, national institutions, to make sure that we have a common understanding in terms of what we need in this framework. On the side of sort of the technical standards, capacity strengthening, we had last month, we had a data and metadata management training workshop that was run by colleagues from the Closer project, John Johnson and Haley Mills, with support from colleagues from the Kamuzu University of Health Sciences and Meru. So what do we think are our next steps? So going forward, we would like to establish a national network of health data management professionals who can take, who can sort of provide the technical support in developing this data sharing framework. But ultimately, we aim to have the ethics bodies and the Ministry of Health in Malawi to take ownership of this, not necessarily individual non-governmental research institutions, but rather the line ministries within the government of Malawi to take ownership. Then we, this national network of health and data management professionals to contribute to annual workshops where the Ministry of Health and research institutions and ethics bodies come together to deliberate on how they can continue to work together. We will review some feedback we got from the workshop that was done last year reacting to this data sharing framework, and also to leverage the infrastructure that's being set at these national universities that I talked about. And we are planning to continue partnership with the Closer project, mainly on the capacity strengthening side. I think that's all I had for now. Thank you.
Thank you very much, Dr. Kanjala. And now it's time for the Q&A. Any question from the audience? Yes, sir. Oh, it's a man.
Hi, thank you so much for that. It's very interesting to hear from the latest in Malawi. I'm just wondering, I was curious about the bill you mentioned from last year. I'm just wondering what are like some of its key points and how will it impact researchers and open data and data sharing in Malawi, you think? Thank you.
That's a good question. We are working on this collaboratively, so I don't have too much detail on the bill, but one of the areas that may be a little bit that may cause changes with research is to do with storage of individually identifiable data on the cloud. I think the current understanding is that the government, unless a research institution has very good reasons to store individual identifiable data on the cloud, the preference of the government is that it's all physically stored within the country. So I think once it's enacted, there will be maybe issues for further discussions around storage of individually identifiable information on the cloud. That's one area that I can think of. Yeah.
Thank you. More questions? Yes, sir.
Hello, Chifundo. Thank you for your presentation. I do have a question in terms of access health data in Malawi. How is the process that one has to go through? And also in terms of the language, if you standardize all in English, or if you have health information in Chichewa and other languages as well. And I wonder how this works, accessing the data and also language. Thank you.
All right. Thank you. So as I said in the presentation, the Ministry of Health, because prior to setting up the standard operating procedures for data access and release, it was mainly each research institution setting up its own procedures and data sharing agreements that they would ask each person or each institution asking for data. They would need to complete this data sharing agreement. But now the expectation by Ministry of Health is that the procedures laid out in this standard operating procedure that they've developed be followed, whether you are asking for data from Ministry of Health or from research institutions that are operating in Malawi, because research institutions operating in Malawi are custodians of data, but the general ownership of all the data collected is with the Ministry of Health. So I don't know whether that answers your first question. The second question about the language. As far as I understand, research institutions generate data collection instruments in English, and they translate them into local languages, Chichewa and Chitumbuka and other languages for data collection, because some of the individuals from whom data are collected may not be conversant with English. But then when the data come out from the field where they are collected, they are stored in systems that are in English. So usually electronically stored data in Malawi would be in English. It's very rare to find data just stored in local languages. So I hope that answers your question. Good.
All right. Thank you very much. Yes, he's signing that. He's giving a sign that you have answered his question.
Good.
All right. Thank you so much. Our next presenter, Cici Akelo, is a librarian. She's a library assistant at Law Development Center, and she previously worked at YMCA Comprehensive Institute as librarian. She has a bachelor's degree in and postgraduate diploma in info systems from Uganda Management Institute. Unfortunately, she didn't manage to join us today due to power interruption in her area, but she'll be sending us a copy of a recorded session, and will be sent out to you. So that's all that we have today. Thank you so much. I'm your chair for this afternoon, Manuela Losanes, and I hope to see you around. Congratulations to all the presenters.
Thank you very much. Thanks everyone for attending our session.